Hello everyone. In this second section of the lumbar vertebral spine, let us see the anatomical structure of the intervertebral disc. We know that the lumbar vertebral spine withstands high amount of compressive load, so therefore the disc has to be strong enough out here. So anatomically the intervertebral disc at lumbar vertebral spine are thick. Intervertebral disc, it increases in size from cervical to lumbar region by 3 mm in cervical region to 9 mm in lumbar region. It makes 20 to 33 percentage of the length of the vertebral column. Intervertebral disc is absent in C0 and C1, that is atlanto-occipital joint, as well as atlanto-axial joint. The content of the intervertebral disc are the nucleus pulposus, which is the central body. You can see this is a jelly structure in the central part of the intervertebral disc called as nucleus pulposus. So the nucleus pulposus is composed of matrix containing glycoaminoglycans. This link together to form proteoglycans, which attracts and retains water. Next part of the intervertebral disc is the annulus fibrosus. It is the bunch of collagen fibers arranged in concentric and circular manner around nucleus pulposus. So this protects the nucleus pulposus from oozing out. Annulus fibers outer layer blends with anterior and posterior longitudinal ligament to reinforce the stability of the intervertebral disc between the vertebral body. They are attached to the cartilaginous end plate of the vertebral body, which is called as vertebral end plates. So vertebral end plates, it is a thin layer of cartilage that covers the superior and inferior surface of the vertebral bodies. So this vertebral end plates supplies nutrition to the intervertebral disc. Coming to kinetics, that is the forces acting on the intervertebral disc as well as vertebral spine. Let's talk about the axial compression. Lumbar region withstands tremendous amount of compressive load produced by the muscle contraction as well as the load of the upper part of the body. Most load is passed through the anterior segment of the lumbar vertebra. Posterior can load from 0 to 30 percentage depending upon segment's position. We just need to remember here that there is already a tremendous amount of load that is being put on the lumbar vertebral column. Due to this pre-existing weight, the vertebral body is compressed as well as the disc is flattened, which tends to move latero-posterior direction. As you can see in the picture here, nucleus pulposus, which is in the center, starts moving laterally. There is a shearing force over the facet joint and it tends to approximate. So here is the facet joint of the lumbar vertebral spine, which tends to approximate because of the compressive loading coming from the upper part of the body, which creates a shearing force because of its alignment. So it can be called as compressive shearing force. So you can see here to visualize how the shearing force acts on the facet joints because of the angulation of articulating surfaces of the facet joint. We know there is a pre-existing compressive load during standing and sitting. Now further compressive load will increase when we tend to bend forward. So which part of the lumbar vertebral spine will experience increase in compressive load? So flexion will increase compressive load anteriorly and distractive force posteriorly. This we already know from previous vertebral spine classes. Now when we add up the load which was already existing, that is the load of the upper body and the forward flexion, which will increase the load on the anterior part of the spine. On top of that, if the person is carrying additional load, then there will be tremendous amount of load acting on the anterior part of the vertebral spine. So there will be huge compressive force acting on the anterior part of the intervertebral disc, due to which the nucleus pulposus will shift towards the extreme posterior lateral direction. If the force is sudden on the anterior part of the vertebral spine, the nucleus pulposus may come out tearing the annulus fibrosus. So therefore, lumbar vertebral spine experiences maximum amount of disc bulge. During lateral flexion, the compressive load will be on the side towards which the lateral flexion is being performed. In this picture, it is a side bending towards the right side. So therefore, the compressive load is towards the right side of the intervertebral disc, which will cause displacement of the nucleus pulposus towards the left side. This is an anterior posterior view of the spine. Let us try to understand from this video demonstration how the intervertebral disc looks like and where it is placed. So this intervertebral disc, as we know already, it has a annulus fibrosus, which is the outer layer, and nucleus pulposus, which is the center layer. It is placed between the vertebral body. If there is extreme compressive force, there may be posterior disc bulge, which may compress the nerves posteriorly. So the disc bulge is because of the tear of annulus fibrosus, which is mostly latero-posterior tear. Due to flexion and extreme loading anteriorly, there will be disc bulge posteriorly because of the sudden shift of the nucleus pulposus posteriorly. It may be gradual or it may be sudden. This bulge posteriorly may compress the nerves, that is nerve roots, which are coming out from the spinal cord. So here you can see the nucleus pulposus starts shifting posterior laterally, tearing the nucleus pulposus, and then it comes out and compresses the nerve root. So when it compresses the nerve root, the chief complaint of the patient would be low back pain with radiating pain towards the posterior part of the pelvis, radiating downward on the posterior aspect of the thigh and the calf. Now let's discuss about the axial distraction. So we discussed about the compressive force. Now let us discuss about the axial distraction. The axial distraction can be created with traction. So during distraction, the weight over the disc and the vertebral body is reduced and the disc tends to move centrally. So there is increase in the space between the facet joint. Distraction is limited by the tension created over the ligaments and the muscles. Next force we can discuss about is torsion. The rotation of the vertebral column can create a force which is called as torsional force. The torsion force with flexion or side flexion can produce even more compressive force acting on the intervertebral disc. So therefore the couple movement, that is flexion with rotation, will create more chance for disc bulge. Next force we can talk about is shearing force, which mainly occurs in the facet joint. But here we are talking about the shearing force occurring at the lumbosacral angle, that is between the lumbar L5 and the S1, that is sacrum. The lumbar segment are subjected to anterior shear force on standing due to the lordotic position, body weight and ground reaction force. So the weight is coming from above downward, but there is a small curvature here which is lordotic. So because of this lordotic curvature, there will be a shearing force which will be acting maximally at the L5S1 junction. If there is too much of load coming downward and if there is too much of curvature at the lumbar spine, then there may be shearing force breaking the lamina of the spine, which can be called as spondylolisthesis, that is the fracture of the vertebral spine. In this picture you can see the breakage of lamina or pedicle of the vertebral spine, which is called as spondylolisthesis. So this may occur because of the extreme force coming downward on the vertebral spine and increased lordotic angulation. This bar chart describes the strength of the ligament around the vertebral spine. So in mid to low cervical spine, you can see the strength of the ALL, that is in black, that is anterior longitudinal ligament, and PLL, that is posterior longitudinal ligament, are weaker than the capsular ligament. Whereas in thoracic spine, you can see the anterior longitudinal ligament is the strongest. But in lumbar spine, all the ligaments are strong compared to thoracic and cervical area. Among them, the anterior longitudinal ligament and the posterior longitudinal ligament are the most strongest ligaments. Muscles that are responsible for creating forward flexion At lumbar spine is psoas major, rectus abdominis, external and internal oblique. Muscles that create extension are latissimus dorsi, erector spinae, transversospinalis, and quadratus lumborum. Multifidus rotators and gluteus maximus also can create extension at the lumbar spine. Side flexion is created by latissimus dorsi, erector spinae, quadratus lumborum, etc. Rotation is created by rotators and multifidus primarily. So this is the end of vertebral spine biomechanics. I hope you have understood and gone through all the video lectures. I would request you all to follow the literatures from the books which I have already mentioned at the end of thoracic spine biomechanics. The objectives of these video lectures were basically to improve the understanding of biomechanics at the vertebral spine. So I have not gone much into details because first the important thing is to understand the concept, and secondly we will start gathering the knowledge about this concept. So I hope you have understood some amount of concept about biomechanics and kinesiology, the movements and kinetics, the forces acting at the vertebral spines which are important for our biomechanical functions.